I'm Tanja Houweling. I work at the Department of Public Health at Erasmus MC and at the UCL Institute for Global Health. I'm a social epidemiologist and I specialize in health equity impact evaluation in low and middle income countries. We all know that the poor and less educated have worse health outcomes than the better off. But what can we do to address this problem, and how do we know what works? I was scientific coordinator of a project with randomized trials in Bangladesh and India, in which we tested a intervention with women's groups. And these women's groups, they came together every month under the guidance of a facilitator. They discussed problems during pregnancy, the newborn period, as well as delivery. And they collectively identified strategies and implemented those strategies to address this problem. And we found out through these trials that women's groups can have a very strong impact on newborn mortality, up to 40–45% reduction. Then in a new project that I lead, we looked at who actually benefits from those women's groups most. We thought that it would be the rich, because they normally tend to benefit most from interventions, but we found that when we combined information from 4 of such trials, that actually the poor and less educated benefit most. We examined why that's the case, and we found that women from all social layers participate in those women's groups. That's because, and especially the poor and less educated, and that's because the groups are established in the hamlets where these women live, and the facilitator uses a language that is easy to understand for women with little education, and she uses games and storytelling that relate to the lives of poor women. So in other words, soft targeting works. But of course that's not enough. You need to address the behaviors that actually have a strong impact on mortality, and such as thermal care and hygiene, and probably these behaviors especially affect survival amongst poor children. So in a nutshell, that's what I do: contribute to the science on how to reach the poor and reduce health inequalities. And what I find really exciting is the link with my colleagues in the field in India, Nepal, in Bangladesh and Malawi. We're really in very frequent contact, and I learn so much from their in-depth knowledge of their local context. There's really mutual capacity building going on. And it feels great to be connected and to work together on something that makes this world at least somewhat a better place.